How does the US health system work? Healthcare in the United States is organized in a complex bureaucracy. While in the rest of the world, healthcare facilities are owned mostly by governments or by private sector businesses. In the US, a large share of hospitals and clinics are owned by private non-profit organizations. Yet, the United States is the country that has the highest healthcare expenditures in the world. While these expenditures are covered in a large share by public payers as by federal institutions or state and local governments, they can also be covered by private insurance and individual payments. At the same time, unlike most developed nations, the US health system does not provide health care to its entire population, as there is no single nationwide system of health insurance. The United States primarily relies on employers who want provide health insurance coverage to their employees and dependents. In addition, the government has programs that tend to cover health care expenses for the fragile parts of society, as the elderly, disabled, and the poor. These programs differ from one another and all have a specific kind of people that are subject to getting health insurance in the US is not an easy thing. Someone may claim that once you have money, everything is easy passe. But in fact, things are a bit more complicated. One must be very careful and look out to pick the right insurance. Health insurance in the United States for non-citizens. The United States government does not provide health insurance for all the people, and health insurance is not obligatory for those living in the US. It is optional but highly recommended and necessary since health services are very costly, more than in any other country anywhere across the globe. There are two types of health insurance in the US, private and public. Most people use a combination of both. The US public health insurance are Medicare, Medicaid, and Children's Health Insurance Program. Medicare is a national health insurance program that dates back to 1966. It provides health insurance for US nationals older than 65 years old, but also for younger people with end-stage renal disease, ALS, and some other disabilities. Data shows that in 2018, Medicare provided almost 16 million individuals with health care in the US, over 51 million of which were older than 65. The Medicare program is divided into four parts. Part A, which covers which covers hospitals, skilled nursing, and hospice services. Part B covers outpatient services, including some providers services will inpatient at a hospital, outpatient hospital charges. Part C is a alternative called managed Medicare, which permits patients to select health plans with a least the same service coverage as a Part B and A. Often the benefits of Part D and an annual out-of-pocket spend limit which A and B lack. To sign in this part, one must sign in Part A and B first. Part D covers mostly self-administered prescription drugs. Medicated. Medicated is a federal and state program that helps people with limited income and resources to cover medical costs while covering benefits normally not covered by Medicare as nursing home care and personal care services.